Today we will be discussing about pulmonary embolism and deep vein thrombosis. Both of these conditions fall under the category of venous thromboembolism. Now let's take a flight. Here's Jim. He's flying economy class from Singapore to London for a business conference. 16 hours later, the plane has landed and Jim is on his way to the arrival hall. Then suddenly, he simply collapsed and died instantly. An autopsy revealed that the cause was myocardial infarction. Well, what could have caused it? Let's rewind and take a closer look. The cause can be found in Jim's deep calf veins. In normal blood flow, the red blood cells and platelets flow centrally in the blood vessels. However, during long periods of immobilization, such as long flights which constrict movement, normal blood flow can be disrupted and these blood cells may accumulate and form a blood clot called a thrombus. In serious cases, the thrombus can cause the vein to rupture and burst, and resulting in blood clotting. However, before the clot is formed, the gap remains opened, causing the red blood cells to escape. This process is called endothelial injury. As for the thrombus, it is called a venous thrombus as it is formed in the veins. It consists of red blood cells, platelets and fibrin. Blood clotting will occur to close the injury. Eventually, the thrombus formed will break off from the site of accumulation and is called away with the bloodstream. This is called an embolus. A detached intravascular mass of either solid, liquid or gaseous nature, which is carried from its origin to a distant site by the bloodstream. The embolus can travel from the leg, upwards to the brain, heart and lungs. In this case, the embolus has traveled to the heart via the inferior vena cava into the right side of the heart. Here, the embolus will be lodged and block the blood vessel. This will lead to ischemia and eventually myocardial infarction. Hence, Jim suffered from acute right heart failure or acute cor pulmonare. Moreover, another possible reason could be that 60% of the pulmonary vasculature has been blocked by the emboli, which results in cardiovascular collapse. The whole process is called deep vein thrombosis or DVT for short. Now let's go more into the details of deep vein thrombosis. Firstly, the causes of deep vein thrombosis. It may occur a person sits or lie down for long periods without moving. This is known as long-term immobilization. Immobilization can happen from long hospitalization or long-hour flights. DVT can also occur due to genes that encode more clotting factors, resulting in easy blood clotting. It is caused by the blood clot embolus, or by air bubbles during trauma and tumors from cancer cells. This condition can be passed down from the parents to subsequent generations. Another risk factor of DVT is postpartum or pregnancy. The placental tearing releases substances that favors clotting, increasing the risk of blood clotting and hence DVT. Now let's move on to the symptoms of DVT. Although there are no definite symptoms characterized for DVT, some conditions are commonly observed. One being sudden swelling in the lower part of the legs. A rupture in the veins may have occurred and the fluids have escaped into the extracellular matrix and accumulate, resulting in swelling. Visible surface veins are another symptom of DVT, where the veins become varicose veins. Lastly, leg fatigue is also seen as a symptom of DVT. As blood is not flowing properly, there is a drop in oxygen, water and sugar supply resulting in dehydration and empowerment of muscle tissues to work. Thus, the leg muscles are unable to work and move properly, resulting in leg fatigue. Now we will be moving on to the complication of DVT. Some examples are pulmonary embolism, which will be explained more in depth later in this video, and post-thrombotic syndrome, where the clot remains too long in the leg veins causing damage to the vein or valve in the vein. Valve damage can lead to backflow of blood, called reflux, which causes blood to pool in the leg. However, DVT can be diagnosed and treated early. First is venography, using a special X-ray that shows the anatomy of the veins, to check for blood clots. Next is duplex ultrasound. This test uses high-frequency sound waves to produce images of the blood vessels on a computer. And lastly, magnetic resonance imaging or MRI, which uses radio frequency waves and a strong magnetic field to create detailed images of the human anatomy. Now we will be explaining more about pulmonary embolism. Firstly, the causes. It can result from blood clot embolus as mentioned before in the scenario, which results from the accumulation blood and plasma proteins forming the embolus. Next is from the formation of air bubbles, usually from chest injuries, which results in injured blood vessels. Lastly is from the formation of cancer cells causing tumor growth, which result in cancer cell embolus. Now the symptoms of pulmonary embolism. They involve coughing out pink, foamy or bloody mucus. Next is irregular or abnormal heart rates and sudden chest pains due to coughing or deep breathing. Now the consequences or complications of pulmonary embolism. They can be serious, possibly involving pulmonary infarction or death of lung tissues. Pulmonary hemorrhage, which is bleeding in the lungs. And as mentioned before, acute cor pulmonare. Or simply put, death. So let's go through the diagnosis of pulmonary embolism. Although pulmonary embolism is hard to detect, there are some tests that can help detect it. One being D-dimer tests, specifically moderate to highly sensitive D-dimer test, which is sensitive for venous thromboembolism. Another test is ventilation perfusion lung scanning, for patients suspected with pulmonary embolism. The D-dimer is formed when cross-linked fibrin is lysed by plasmin, in elevated levels where pulmonary embolism occurs. Where the larger the size of the perfusion, the more easily it is detected and it may result from pulmonary embolism. Now is the end of our video. Here are some references about pulmonary embolism and deep vein thrombosis. Thank you for viewing the whole thing.